Hey, big guy, what are you doing over there?
I've been on fire all day.
On fire?
Yes, I was giving a talk to the Fire Death Days. Then I did a panel with all kinds of fun people, including your favorite Australian national treasure.
Graham Grieve?
Graham Grieve was on there.
Oh my God, he's a national
5
treasure
a.m.
in Australia.
He is, Graham Grieve. So I heard from motorcycle guy Keith Boone that Graham went into self-quarantine for 6 months and came out and wrote Fire. And that was
Okay,
how
so
we got
Graham's
it.
fixed interoperability, and we're going to talk about it on the June 17th episode of Health in 2.00. So being as we are correcting everything that's wrong with healthcare, starting with Graham Grieve and his bunker, fixing interoperability, we also, Mr. Holt, need to issue a correction because we got duped last week.
No, we were wrong about something. Well,
we were not wrong. No. In our defense, we were not wrong. We got tricked like everybody else from Patient Ping. That tricked us with their false press release talking about their fundraise that actually happened a year ago.
And then apparently since the fundraise, we've heard that up to 20% of their staff recently were laid off. So unclear exactly what happened, but we reported last week they'd raised $60 million. I said I think they were growing quite fast, and apparently they grew fast.
Yeah, we thought that was new money, but no, that money's been there for a year. They waited a whole year on that news.
Well, who knows? That's what happened. We're all a bit confused about it.
Why would somebody do that? Why would a startup do that? Does that make sense?
There are some startups that definitely hidden rounds and haven't talked about rounds they raised.
For that long?
Where do you hold off for a whole year and then announce the whole thing? You probably just wouldn't ignore it.
I would tell everybody I knew. Like, I'm like the worst secret keeper ever.
All right. So if you want as a VC, if you want your round to get blasted everywhere automatically, give them
Tell me. I love things. I'm very good at embargoes, like right down to the minute. There was like a point I had to wait like till an actual time. Yes, but no.
After that, you're like.
After that, it's a goddamn free-for-all.
Okay, so.
Okay, you ready? Set your little
2
timer.
minutes, ready.
Oh my God, we have so much news.
Go.
Oh my God, continuing with scandals. Proteus, bankruptcy.
Okay, well
We saw this coming.
We knew it was coming, right? Because we talked about how they were in trouble, they were laying people off, and Chrissy Farr got the news last night. They're actually going Chapter 11, trying to select Otsuka, which is one of the original partners. They probably never really survived the fact that they tried to create a drug for people with paranoia that involved a chip that was spying on them, and frankly, it was always too damn expensive. Pilot.
Yeah, end of an era. All right. Walmart has bought the tech from CareZone for an unconfirmed $200 million. This is to compete with PillPack. What's going on here, Matthew?
I don't understand why it's competing with PillPack, because this is the tech. The bit they bought is not the pharmacy bit that PillPack has. CareZone has something like that. This is the bit that CareZone has, which kind of like manages it's a drug medication thing. Sounds like a hell of a lot of money. I don't know why that. I've always had my doubts about CareZone, but they clearly knew something I didn't.
All right, Kyruus gets $30 million.
It's another 30. It makes it what, 120, 130? A real number now that Graham Gardner's had. By the time he turns that thing around and actually sort of spits some money back to his investors, but they seem to be getting a big dominant space in that sort of making referrals, scheduling for big health systems.
All right, what about Headspace? They closed a C round, $47.7 million. On top of what we just raised. Another round.
They raised like, 50 and 40 in debt earlier. Having said that, I read somewhere, TechCrunch, they had made 56 million in revenue and subscriptions last year. Maybe they're trying to move into the health plan space.
But what about Calm? Like, isn't Calm already in that space?
Is that a funding? Yeah, I don't know. Calm has raised more money and has higher subscriptions. So.
All right. What about CareAcademy? They get 9.5 and an A.
This is Smooth. This is a relatively new company. It's been around and it's doing online training for caregivers, professional caregivers for seniors, niche space, sounds a lot of money. And that's what I have to say about that.
That was like the
Oh, no, I have one more thing to say about it. I'm blanking on her name, but it's a rare case worth mentioning because of how few there are, where it's an African-American or black, we don't speak to the term black now, black CEO, female black CEO is running that company, CareAcademy. So congratulations to her. I will think of her name in a few seconds. Give me a second. Talk about something
Give you a
else.
second to Google it. Is that what you're saying?
All right, I haven't made it. I don't know her name. I feel terrible.
Well, I mean, do you want me to make up an excuse why you don't know her name? I don't know.
I forgot. I
Forgot. You're getting old there.
I've been
You're getting old man.
All right. Helen Adioson.
There you go. All right. Helen, congratulations on your raise. That's awesome. Oh my gosh. Yeah, Matthew. Unbelievable.
It's unbelievable. I'm stupid and can't remember his name.
I think it's ironic that it's on the one thing that we talked about that has to do with senior care. So you better learn her name and try to remember that, my friend.
And brain training and yeah, we didn't mention, it's not a deal, but Akili got FDA
approval
for their digital therapeutic.
This is like such an interesting day. I mean, like not to go back to Proteus, but it's like that was so hot a couple of years ago, and that was supposed to be the future of this whole digital health era. And then here we are now, and people are saying the same thing about Akili.
I would have to tell you that, it's a video game that's supposed to improve your concentration in the video game, maybe when you leave the video game. My kids are playing Animal Crossing. I can tell you they're terrible at work. They're terrible at doing their schoolwork. They can't pay attention to anything. But in Animal Crossing, they are so focused for so long. I don't know
Maybe
whether you have to have a prescription for that.
For the dollars, baby, for the dollars. Speaking of which, if you want to contribute some dollars to us.
Oh, yes.
Yes, we are happy to welcome sponsors, of course. And if not, you can just follow along with us for free on Twitter. He is at BoltyBoy and I am at Jess Damasa. And of course, you should go to thehealthcareblog.com and sign up to receive our email newsletters. Oh, look at that. Nice use of a prep there. Go to thehealthcareblog.com, sign up to get our email newsletters, which not only feature these cute little Health in 2.0 episodes, but also a bunch of curated content from the blog. Mr. Holt.
Mr. Master, do we have a bunch more news? We do all these tomorrow?
Actually, we do, and we learned our lesson by going for multiple rounds. So we will be back tomorrow with another episode.
Okay.
I couldn't even sit through watching that when we went 3 rounds in. I gave up like halfway through the second one. I'm like, I lived it. I don't need to do this again. But anyway, you're charming, and we'll see you guys tomorrow. See you soon. Bye.